Hello, everyone. All right, let's get started. So hello, everyone, and thank you for joining us. Today is the last session in the USBC's Technical Assistance Series for Coalitions. My name is Miriam Rodriguez. I'm here with the Senior Coordinator at USBC, and I'm joined today by my co-moderator, Danae Schmidt. And here we are. So today's technical assistance is part of a seven-part series uniquely designed for state, territorial, local, tribal, and cultural coalitions. And it has been a range of topics that are salient to every coalition. These topics have included advocacy, like today, diversity, equity, and inclusion, and more. To access these sessions, it has been completely free, and the recordings are available on the USBC website, which we can share in the chat box. Today's session, we do ask that you keep yourselves muted until noted otherwise. And you are welcome to share comments or questions in the chat box. Today's topic will cover all about advocacy. Advocacy can be a powerful impact on policies that surround lactating families. And breastfeeding coalitions have an important role to play in advocating for efforts around local, state, and national level. But getting involved can sometimes seem overwhelming or daunting. Today, we're going to hear about different types of advocacy, insights on how to get involved, and ideas for connecting with policymakers at every level. So with that, I'll pass it over for everyone to get introduced.
Good afternoon, everyone. We have with us on today Linda Kopecki with the Minnesota Breastfeeding Coalition in the Twin Cities Regional Breastfeeding Coalition. We also have Jada Wright-Nichols with the Cultural Breastfeeding Coalition B-Stars, breastfeeding sisters that are receiving support, and Board of Directors for Breastfeeding USA. We have Jada Metcalf with us, Secretary of Georgia Breastfeeding Coalition, Community Breastfeeding Transformer with Rose, and leader of the future IBCLCs of the Color Group. Stefani Rupnicki, leader and founder of Prairie Band Potawatomi Nation Breastfeeding Coalition, a member of Northeast Kansas Breastfeeding Coalition, and the chair-elect of Kansas Breastfeeding Coalition. And we have Jacqueline Lambert with the Delta Breastfeeding Coalition and founder of the LOCKS Task Force. Next slide, please. So our objectives on today will be to describe the different types of advocacy that coalition can engage in, describe the difference between little p versus big P, and relate the power of storytelling plays in shifting policy. So advocacy is for all types and sizes of coalitions. There are different types of advocacy. Even if we've eliminated ourselves from the possibility of engaging in advocacy, we have probably already been engaged inside of advocacy. So our next presenter will be Ms. Jada Wright-Nichols.
Advocacy can make a significant difference in ensuring that everyone has access to coverage, care, and improved health. You and your coalition can play a vital role in educating public officials about issues important to healthcare outcomes and consumers. Legislative advocacy refers to efforts to influence the introduction, enactment, or modification of legislation. The most common means of legislative advocacy is direct lobbying, which entails contacting a legislator, sharing your views on an issue, and asking them to vote on a specific way on a bill. Your first step is to decide which issues you'd like to talk about. Are there important healthcare programs to you or your organization? that you believe should be maintained or strengthened? Is there something you'd like to see changed in your state healthcare system or nationally? And then you'd want to discuss your issues with coalitions, colleagues, and other healthcare advocates as a good way to narrow down your topics and make sure your message is focused. Then you'd want to identify your audience. Once you're clear on your priorities, make sure that you know who makes the decisions that shape your issue, whether you are advocating on a local, state, or federal topic. You need to figure out whether your issue concerns a federal or state program. And then, of course, you need to find out who represents you. If you're unsure of who represents you in Congress, you can go onto the website www.govtrack.us to find your state representatives. And if you are in need of knowing those individuals at the state level, you would just go onto your state legislator's website. Next slide, please. Educating policymakers refers to sharing facts and stories related to a specific policy position. This is an active process in which other stakeholders are also demanding the attention of lawmakers. The steps you'd want to follow are identifying your goals and a strategy, know your resources and assets, address both support and opposing messaging. The work of Moms Rising is a wonderful example in bringing real families and real stories to policymakers to help explain the consequences of action as well as inaction. Anyone can educate public officials about the importance of healthcare and how they impact the lives of those people they help and represent. Regardless of the subject you are contacting your elected representatives about, it is important to have a clear and concise message and know what action you'd like for them to take. It's important to know the why of your message, as well as the what and the how. Articulating the why allows you to convey a detailed picture and leads your audience to become more engaged in your message. Um, Equally important is connecting that story to your issue and conveying what you would like your public official to do about it. Next slide, please. Administrative advocacy encompasses a variety of positions concerned with influencing the formation, application, or change of rules that government agencies put in place to implement statutory law. Some ways to do this are to comment on proposed laws or regulations, requesting the enforcement of existing regulations, advocating for or against executive orders, or representing parties in administrative hearings. Your coalition and colleagues will need to research skills, writing skills, um, oral advocacy skills, and analytic skills. That may sound complex, but it really does not need to be overcomplicated. So let's take a few minutes now in the chat and so that we can share what types of advocacy you or your coalition has participated in or would like to participate in. Are there any topics that you have already addressed on any of these levels or that you've been thinking about addressing and would like to get started? So any legislative advocacy, have you contacted um, state or federal officials about any topics? Have you signed on to any letters that that have been circulated? See if I'm able to read. And all right, before my time, NBC tried to get a licensure bill through the Minnesota, oh, this is from Linda, Minnesota legislature They employed lobbyists. It failed, unfortunately. Yes, so licensure in lactation land is a great big deal. So, and even within our profession, um, there are some who are for and against different types of licensure. So it's quite complex for sure. Yes, paid family leave is another. What about just educating your public officials? From Cheryl, in my work on the Weekly Wire, I've seen lots of coalitions working on workplace rights, absolutely student rights, and breastfeeding in public. Yes. From Jill, speaking as a parent in New Jersey, I'm involved in administrative advocacy for breastfeeding and child care policies. New Jersey Breastfeeding Coalition just did a booklet for child care centers, which is a tremendous tool. It is so helpful. Um, I think child care facilities just have no idea about what to do with breast milk. And so, yes, working on a toolkit, an educational guide for those is quite helpful. Our Title V, this is from Ann Davis, our Title V state manager soliciting input from the public on their programs right now. Engaging our members to comment on this is important. Yes, so right where you are, just send that information out to everyone in your network so that they can add to the comment for sure. Cheryl's adding, I've seen lots of coalitions working with departments of labor and health, working on regulatory guidelines that enforcing agencies use, going too fast, to implement lactation protections. Absolutely. More in Minnesota, the Department of Labor just got an amendment to the workplace lactation law. Yay. Time now to be paid. Absolutely. We supported the process but did not lead it. I call that administrative advocacy. Yes. So that is just adding teeth to existing protections for sure. Anna Robertson is asking Jill to slide the toolkit her way. Uh, she just started working with a group that got a grant to train early childhood educators on being breastfeeding friendly through the state health department. So yeah, that'd be helpful. Awesome. So I think all three of these lanes are being covered already just among this group. So let's keep it up.
Hello. Big P, Little P in Action, Promoting Access to Healthy Food from the Association for Maternal and Child Health Programs. Big P. Congress and the executive branch revised federal SNAP, Supplemental Nutrition Assistance Program, income eligibility limits, allowing more families to purchase nutritious food. Little P, a public, oh no, what happened there? My screen went crazy, sorry. A public health organization passes a healthy snack policy for all meetings and events. A county school board institutes an incentive policy for vendors to supply nutritious and affordable food for school lunch programs. A local food pantry institutes a policy mandating that fresh produce constitutes 25% of the food distribution to clients. Oops, next slide. Polls, little p versus big P. Miriam?
Yeah, I'll go ahead and launch that now. And I'll give
What type of policies change do you mostly engage in?
Great. So I see about 60% have
And
participated. I'll go ahead and
is everybody still commenting or taking the poll?
Mhm.
Okay.
I'll give people another second or two.
Yeah. I say after this, we'll have a participant share in the chat sections that particular topic of advocacy they want to work on next.
Okay, so I'll go ahead and show these.
So we have a good, let's see, Little P Policies seems to be the lead on that one. I know I'm just getting into a little bit of advocacy work with Medicaid expansion in my state. So this is very new to me. All righty. Let's see, finding our voices, advocating for Medicaid expansion. I was encouraged to advocate for Medicaid expansion in Kansas. My story about my family, our medical needs, and our struggle to be insured is personal, but our community's needs for health insurance isn't personal. I'll share a little bit of my story with you. Take a drink real quick. Excuse me. Advocating for Medicaid expansion in my state of Kansas. I've never done advocacy work like this before. Putting myself out there has been different because our health is a personal subject, but our right to have access to health insurance isn't. I have struggled with not having insurance for a good deal of my adult life. My family lives within our means. I'm a stay-at-home mom working part-time parent with my partner working full-time. Being a family of 8, though, is expensive, and so we make sure to meet our basic needs. However, insurance falls short for myself. I'm sure a lot of other parents can relate with that, putting ourselves on the back burner mindset. My children are able to receive state health insurance due to our family to income ratio. And I'm so very relieved that I don't have to worry about them not being insured. My partner is an electrician apprentice and receives health insurance through his union. Upon completing his apprenticeship, we will be able to have our whole family covered for free. This is something we have been working towards, being able to have our own and not have to have that stress and worry anymore. However, the struggle prior and still will with not having, having insurance doesn't go unnoticed by me. Prior to my partner's current career, we couldn't afford health insurance added on for us as a family, as it would have taken an entire paycheck. That is just too much. I only get insured when I'm pregnant and 2 months postpartum, which is why I started my advocacy journey for Medicaid expansion in my state. Postpartum women have health issues beyond 2 months after having a baby. Our bodies go through so many changes, hormonally and physically. If a person has a mastitis at 3 months and no insurance, what is a parent to do, especially if they can't afford to pay out of pocket? There are so many stories like this and so many people and below the cusp of not being able to receive Medicaid in their state that hasn't expanded. What type of advocacy is this? Educating policymakers with our own personal stories. Administrative advocacy, commenting on and making suggestions for the implementation of existing rules of law. My partners, for me, have been the Kansas Breastfeeding Coalition. I shared my story with the executive director, Brenda Bandy, and it made a huge impact on her. And so she reached out to the Healthy Alliance for Healthy Kansas, and they contacted me so that I could help share my story so that we could get Medicaid expanded in Kansas. It was something also that I have been working with Kansas Breastfeeding Coalition. What can we do to expand postpartum health insurance with CanCare for our moms and our families, because it's only 2 months. So that's something else that we've been trying to work with as well. Maybe something that's beyond the expansion of Medicaid. And this is something that will help get us to that point. This type of policy is an example of working on big P policy. Thank you. And we'll move it on to Jada. Right.
So first of all, I'm wondering, are there, maybe we can ask if there's any questions about that story and that the previous slide. Any questions or comments about this method of advocating, really sharing stories, but working on big P policy?
Thank you, Linda.
Mm-hmm. So I first I have a question for you, Stefana. Is you mentioned the group that the Kansas Breastfeeding Coalition is a part of that Brenda took it to? Is it like a big collaborative pushing towards Medicaid expansion, and then the Kansas Breastfeeding Coalition is a member of that?
I believe so. I've always wondered how I could get my voice into getting things expanded, and so when I became a member of the Kansas Breastfeeding Coalition and started to get into more of the board of directors and became in the chair-elect, and now I'm the chair, I thought, well, Brenda Bandy does big things in Kansas, especially with breastfeeding, and why not take my personal self and try to help others? Because in my community, I hear it all the time. Mm-hmm. I've had clients that, what am I going to do? I don't have health insurance. I have a mastitis. That's a big one for a lot in my community too. And they don't have health insurance because it's already past 2 months. And so I asked Brenda Bandy about that, and it's like, how can we do it? And she was already at one step ahead of me, already doing stuff. And so I'm just kind of tagging along and learning and trying to see if my voice and my story can help, reaching out to others that can do the same thing in my community. So I'm not really sure behind the scenes on that yet.
Yeah. Oh, there's a comment in the chat. So from Anne Ryan Robertson, thank you for sharing your personal story. The lobbyist that will be training their coalition says that telling a story is the best way to get your issue on the table. Yeah, so
it's very true. It's very vulnerable. It feels very vulnerable, but you know, I kind of took a pause about it for a long time because it is kind of personal. But then I'm like, it's not personal though. So many other people are in my shoes too, and they feel the same way, and I don't want them to feel the same way. So you're right. The best way to do it is telling our personal stories.
Mm-hmm. Thanks. Next slide, maybe.
Yes. Thank you, Stefana. That was wonderful, powerful. This photograph is from the 2019 USBC National Conference in Washington, D.C. It was pre-conference, our Advocacy Day, and I had the opportunity to go and visit and collect over 10,000 steps walking across the Capitol to meet with representatives of representatives and so that we could further advance maternal health protections and breastfeeding protections in the existing Affordable Care Act. I live in Atlanta, Georgia. I started my my breastfeeding work in Memphis, Tennessee, and I was born in Dayton, Ohio. So I collected the information of representatives from each of those states. And whenever I saw them, saw their names on the hallway placard, I stepped into the office and spoke to them as if I was still paying taxes in that state. But I went ahead and was able to pass along the information that the very complete, thorough information that USBC had provided to each of us. I was able to follow the talking points. I myself uh, sought a pep talk from Tina Sherman, who does this all the time. And although it seemed very daunting early on, by the end of the day, I really did not want to stop. I kept looking over my list, and I was just like, there are more people, need to hear about this, see about this. I collected uh, business cards of the representatives who I wanted to follow up with. And I happened to meet on that day as he was crossing the street in order um, to cast a vote on, I don't even know what topic. It wasn't this one, obviously, but walking across the Capitol was the late great Representative John Lewis from the state where I actually do live. So I saw him, I could not believe it, and walked beside him for a few steps. And he asked immediately where I was from. I said, I live in Stone Mountain, Georgia. And he asked, what was I doing there? I told him what our goals were, and told him that I was there with USBC. And he said, "Have we signed on to that yet?" I said, "No, sir. I don't think you have yet, actually." And he said, "Don't worry. On the matter of maternal and infant health, you absolutely have our support." And so that it was just a matter of that little nudge. These representatives receive so much information and so many asks, and there was nothing holding up his support except the need to actually sign on. So that helped in this, and we'll get into it a little bit later. It helped me to see even more of the process. It's not sometimes as simple as are you for or against. It can be a matter of, have I gotten to that yet? I absolutely support it, just haven't gotten there yet. So patience is paramount in all of this. Storytelling, as Stefana mentioned, and we'll talk more about later, is very important. Being courteous, being able to be concise about your messaging, clear about your messaging, and two or sometimes three of the states that I was representing on that day don't always go the way that I would like them or we would need for them to go. And so walking into some of those offices was a little bit intimidating, but I was able to speak my truth, speak our truth, speak on the behalf of all of these families, and look the representatives, their secretaries and assistants often in the eye and tell them very matter of factly what it is that we expected and we wanted for them to sign on to. So it was a from top to bottom, just a very eye-opening day and experience, one that I will not soon forget, and hope to have many, many more of them.
I'm wondering if there's any questions or comments about Advocacy Day. I look at this photo and I recognize a lot of people in this photo. And I've heard their stories, similar to Jada's story. I've heard their stories about how transformative it was to engage in Advocacy Day. Cheryl does comment that a lot of this work is just about bringing a policy issue to the attention of an office. Like, did you know? Have you signed on yet?
Right.
Cheryl says USBC Advocacy Day is her Christmas.
I believe that, Cheryl. And you make it so easy. You make it so easy and so accessible and so enjoyable for all of us. So thank you for all that you do. I would just encourage anyone who is who's able to attend an advocacy day with USBC or really anywhere to do it. Absolutely do it.
What exactly were in the kits that you all had, those green bags?
Oh, were those art green bags? That might have been something that Felicia uh, came away with from her from
Okay.
one of her visits. But in our kits, we had um, the names and other identifiers of the um, of the bill. We had some homework to do even before we got there. We had to know whether the people we were going to visit had signed on or not. And so in my case, I was able to visit some who had already signed on and just stepped in, waved, and said thank you. But others, um, too many at that point, had not yet signed on. And so we had some brief talking points, and um, I don't know, I think that's it. I remember having lots of information just like on my phone and rehearsing what I would say.
If I could, I just want to comment on one person in this photo that I know well and how transformative it was for her. If you look on the picture, the far left, you see the woman with the grayish hair and the white sweater and the burgundy pants. So that's Lorraine, and she was my colleague when I worked in Colorado. So Lorraine lives in Salida, Colorado, which is a very small town in the mountains, very isolated. She even gets into Denver maybe 2 or 3 times a year, and that's it. So very isolated. And the ability to meet with legislators at the Capitol building was like a once in a lifetime opportunity for her. And she still talks about that opportunity and just how incredibly transformative it was. It changed her outlook, it changed her trajectory. And it's not something she would have ever had the ability to do without being a delegate for the Colorado Breastfeeding Coalition to USBC.
Yep. So so this is absolutely impacting Big P. But I would just echo what's already been said is that, it's okay. It's expected to start small and to be focused and to join forces. As I look at the photo, we're from everywhere. We're from everywhere. Um, uh, so joining forces with other coalitions and other colleagues and other organizations is what is going to help move whatever it is that you are supporting. So starting small, um, joining forces and just, taking those little bite-sized chunks out of all of the things um, little P is really as important as big P and, and vice versa. Right.
Hello, I am Jada Metcalf with Future IBCLCs of Color, and we are a lactation support group that pretty much helps individuals in the professional setting or maybe just in the community learn more about the lactation profession to create awareness around the lack of representation in the lactation field and to support those along the journey. This is basically, I think it affects more little P policy because we, again, like Jada Wright said, we are attacking small chunks of big policy change. One that definitely I look to a lot is a Maternal Health Care Act that is being pushed by Alma Adams. And it is just an innovative way to make sure that we are controlling the morbidity and the mortality rates. There are research studies that show that medically fragile Black children do better with Black doctors. So we have to think that it's the same with lactation support. My story started with my first child that did not have a successful journey, beginning in the hospital setting. One, there was just a lack of IBCLCs, period, and there were no Black IBCLCs inside of the setting and outside of the setting as well. Fortunately, I was able to try my journey again 3 months later. And this time I had a nurse that was a lactation counselor, and she happened to be Black. And just the connection that I had with her with my journey was a little familial. She was gentle yet stern. It kind of reminded me of my mom a little bit, to let me know that, you know, she's only going to be here for 2 days, so we have to get this down. But it was just a connection, and I saw a big difference in between the lactation support that I found the first time and the second time. Once I left the hospital, it was even more difficult trying to find support groups or IBCLCs of color, or even lactation counselors, especially if you're not in the field somewhat. And I came across Rose, which is reaching our sisters everywhere. And I learned of all of the breastfeeding rates in the Black community and the racial disparities that go along with them. And, you know, one thing that stuck out was there wasn't a lot of, we needed more Black IBCLCs in our community. So I became interested in the field. I began to take courses to become certified. And I began to learn more information that, you know, there's less than 20,000 in the US, and only 2% of those are of color, and 1% of those are Black. So this is very detrimental in our communities, I think, for the lives of our babies to thrive, so that they are able to find representation that looks like them. And every family deserves that. But in finding, you know, me trying to make this a career field, I found that there were other people just as interested. And I also came into contact with a network and a wealth of other IBCLCs, such as Jada Wright-Nichols. She's in this panel as well. But to be surrounded by people, like-minded people that have the same objective as well. The biggest, just to tell our story really does make a difference in changing local policy, because you're able to provide facts. You're able to bring actual people to the story. Just with mine in general, I shouldn't have to wait 1 day to see an IBCLC after having a baby. And just the support that needs to increase for all types of births, whether they're vaginal or C-section. C-section moms really need a lot of support when it comes to breastfeeding, and I happen to be one of those. So a lot of, you know, what happened to me was my personal agenda, and I'm trying to make it a public agenda, because it can affect change in not only mortality rates, but, you know, the increased breastfeeding rates as well. So the group formed, and it's been 3 years in the making, and we have close to 2,000 members. And we have a lot of people that have become IBCLCs. And I get so excited because we have a new round coming up. So we're waiting to see who else is going to enter the field. And hopefully I'll be in that field as well. But this goes back to Linda said an awesome quote, that when you have a group of people, the answer is within the group. And it's the same for the community. I found all of the answers that I needed right in the communities for just being a local mom. And that's all I am, is just a mom. I'm not a physician, I'm not a professional, but I am someone that needed help breastfeeding my babies. And there are other people along. So just to let people know that moms matter, families matter, birthing people matter, and the physicians. We really need to get to the physicians and get them knowledgeable care as well, because they are the ones that are in contact with the majority of breastfeeding families. So if this group can catapult that to more RNs becoming IBCLCs, even doctors learning more about lactation education, I think it would keep the continuum of care, and we won't have so many families that are not reaching their breastfeeding goals.
I'm wondering if there's any questions or comments from the participants or thoughts. I have a question, Jada. Is your organization specific to your geographic area, or have you broadened out to other parts of the US?
Oh, it's nationwide. I mean, we have IBCLCs of color from all over, aspiring IBCLCs. I am located in Georgia. Georgia has a very high rate of infant mortality. So it basically was, you know, my baby for Atlanta, Georgia. But like I say, for 3 years, I'm learning more and see that it, you know, needs to be as widespread as possible. I'd love for it to have chapters or things, but for right now, it's just a community-based organization where you can find information, education, support, vent, you know, what you're going through.
So Jada, the other Jada said it's worldwide.
Worldwide. Yes, we do have some people international. We do. So thank you, Jada. I do. I'm trying to be as modest as possible, but I'm really proud of the group. I really am, you know, the way that it's reached out to a number of people. So like I say, I look forward to increasing the number of IBCLCs, you know, in our communities quickly, if we can.
So Jacqueline has a question. Are there statistics on the number of Indigenous IBCLCs? I know there's more these days.
I don't think there's that many. I think I remember speaking with Kimberly Moore Salas about that. And I think I can remember her saying it's less than 10. I feel it's not that many.
Yeah.
And I have the same story as Jada, you know, with my first and my second, not having a person of the same color and background and with myself. And that's what led me to become a breastfeeding peer counselor. And I'm trying to work that tier up myself so that I can become an Indigenous breastfeeding IBCLC as well. And so I really don't know. There's not that many. I know there's none in my state. So
we thought there were 0 in Minnesota, but a member of our board of directors, Shoshana Kraft, is Indigenous, and she found 1 Indigenous IBCLC in Minnesota. We had never even heard of her. So there may be more than 10 that we just don't know about. I know one community that in Minnesota we're particularly sensitive about is the Hmong community, Hmong. In Minnesota, they have the very lowest breastfeeding rates, and there is only 1 Hmong breastfeeding IBCLC anywhere in North America. So that's one thing we're working on in Minnesota, is trying to get more Hmong IBCLCs.
More representation for all communities of color.
And a lot of people don't even know that this field exists either until they actually get into breastfeeding. So
exactly,
you know, we can get people that haven't become parents, you know, just yet to be interested, because I have a lot of group members that aren't even parents yet, but you know, they're so passionate about it for when their time does come. So, you know, just to create awareness, not only in the community, but in academia as well. So, you know, when you go to college, this is included in your health sciences, you know, courses as well. And it's very expensive to get, you know, curriculum implemented, but we have to try at some level. So even if we can just start with, you know, local support groups and, you know, little groups like, you know, the one that I started, just to get the word out is the key, you know, to get people to hear us, see us.
Just a comment from Nishita Pollard. Totally agree with you, Jada, that she found out about it after her first child. Yeah.
Hello, this is Treva Smith. Can you all hear me?
Hi, Treva.
Yes. Hi. I am the co-executive director of the Kansas Breastfeeding Coalition, and I just wanted to make an announcement that and I'm going to put it in chat too, that we did get a grant. We received a grant for a lactation training program for a clinical training program. And so we are also looking right alongside of you guys, working alongside of you to push forward these lactation consultants of color. So we're look forward to also adding your information to our students, our student and mentor pools.
I'll put the link in the comments.
Thank you.
I guess Cheryl raised her hand. So Cheryl, do you have something to say?
Oh, I actually did that on accident, but I just really appreciate what all of you brought, like Jada, what you were sharing just now around like those stories are so powerful because you can put all the data in the world in front of a member of Congress and they see data all the time, but that's not actually going to change anybody's minds. Like you can't like bring any more powerful picture than your own experience, and like you're the expert in what you've been through, and that is the thing that's going to change heart and minds. And I think what that really brings up for me is what Jada Wright had been saying too around like getting the attention. You know, there's so many policy issues and we are complex creatures and we live complex lives, and breastfeeding is not the only thing in the entire world. But you do have to get it in front of those policymakers and those decision makers and bring their attention to it. And I think that's really the power of coalitions, is that you're able to kind of like bring together who's the best messenger to bring the message on this particular thing. And so I'm just really impressed and excited and so touched to hear all the stories. Thank you.
Perfect segue to our last Finding Our Voices segment with Jacqueline. Thank you.
Yes. I get so heart-wrenching when I hear the stories because I think all of our stories are so much of the same. With LOCS, which is Lactivists of Color Serving, again, when I was just thinking, I had been in a meeting with one of the coalitions, and so, but it was, you know, you're at the table, but you hadn't had that opportunity to have that voice at the table. And so it still wasn't being recognized with families being able to have that support and help that they need. And no one knew who to call in the area, or where these families would get help, or where the providers or the organizations would get help in setting up these lactation spaces. So LOCS, which is Lactivists of Color Serving, came from that. And the goal was to, again, create and promote, but also share current evidence based and culturally diverse breastfeeding information, and to be able to offer not only help to the families that were going home, but also help to the hospitals who were on the baby-friendly pathways, and offer that support to organizations who wanted to set up lactation spaces. And so that was where the idea for LOCS came from, because like both of the Jada said, you know, you did not see it in your area, and you're wondering where people were intrigued with the work around breastfeeding, but the people that were actually doing the work, there was no awareness to them. And so my whole goal was to increase that awareness of lactation care providers of color in the community, so everybody would know where these people were, and if they needed help, who that they can reach out to. So LOCS is very, very new. Very new. It was actually, again, we're part of a breastfeeding coalition, but members were asking, what do you think? We should do this, but no one is listening. And because I had a voice at the table, I wanted to make sure that their concerns were recognized and that their concerns were heard. So we're little P, but oh my goodness, I'm looking to be big P one day. I'm looking to work on policies that would impact change in our area to work on or to participate in those legislative activities that will increase visibility and the influence. So that's a goal, you know, way down, but it is a goal to increase that visibility. And it's strictly for, it has not branch out to the state. It's very local, looking at the Delta area, right around maybe about 7 or 8 counties. So we're looking at work on those things to actually get more visibility in it, to create those platforms that people can find us, to create all of those things that will make us visible. Right now, we are just strictly working on gathering the data or the resources of all these activists who are in the area. So I'm working with, you know, community organizations, breast WIC organizations, people who actually have this staff, and these people who are, these ladies are the BIPOC providers who are actually working and pulling together a pool of resources so that they can be everywhere. So that wherever that mom is, when she leaves that hospital, she will have this information, but also that the hospitals will have this information and daycares will have this information. And when they think about lactation, they would think about a locks. They would hear, they would know exactly where to find us. So we're very new, but our goal is to really work with those activities that will increase the visibility. Like Jada, you know, stated earlier, USBC Advocacy, I think it just put that stamp there to give you that boost to say, you can do this, you know, you can do this. And so I appreciated those opportunities, but that's all for locks right now. Of course, our resources, we're working with the different areas, with baby-friendly hospitals, to pull together all of these resources. One day we'll have those 2,000 plus members, Jada. But right now we are pulling together a few people just to make locks visible and known.
So Jacqueline, Nishita was wondering if you have like a Facebook page or a website or a link to learn more.
No. No, we're actually in the process. I actually have someone working on that to get all of that up and going. So hopefully in the coming weeks, we'll be able to launch it out and then share it out at a larger platform that someone can boost it out to everyone.
So stay tuned, right?
Yes.
So
Jack-
Nishita was wondering if
oh.
you could share your email address.
Sure. It's jackie.lambert449@gmail.com. Let's see if I can type it in.
Yeah, I was gonna say, would you mind putting it in the chat for me, please? Thank you.
Jacqueline, I'm going to put on my B-Stars hat and suggest, you're doing an amazing job for sure. But the way that we started and kind of grew a lot faster than we anticipated was we partnered with anybody who was remotely connected with breastfeeding, whether they knew it or not. And I mean, we got sponsorship from Hooters. We connected with other restaurants, just, you know, in an effort to find meeting places, right? And so that just turned into, hey, how do you support breastfeeding families when they come to dine in? Now we're just there for a meeting space, but we're talking about breastfeeding wherever we go. We connected with the health department outside of the peer counselors, and we got into who's providing contraceptives, and we connected with perinatal mental health counselors in the city. We connect, I mean, yoga instructors and pelvic floor therapists, and just anybody who would listen to anything that we had to say about breasts and breastfeeding. We connected, and that is really how like you're saying, like we want everybody to know who locks are. That's how you go to the people who don't even think that they are remotely interested in what you're doing and show them. We connected with um, fire and rescue to help show us how to become, like community safety representatives or something if there's a big catastrophe in the city. And we talked about how breastfeeding was, life saving in those cases. And they were, these are big burly firemen, and they're like, oh yeah, I guess that is good. And so we got their support. So just everywhere you go, anywhere you navigate throughout your community, connect them with providing breastfeeding support. Amazing job.
Thank you so much for that.
Thanks, Jacqueline. The next one is not one of our, not a member of our planning team, but Cheryl loved to. Okay, I'm not going to pronounce your name correctly, so I'm not going to try. Cheryl.
It's gonna be me, Linda.
Oh, it is going to be Miriam. Awesome, awesome. Okay, so Miriam Rodriguez.
There
We're
you
going to talk about partners. So I'm going to pass it on to you, Miriam. Thank you.
Thank you so much, Linda. And thank you everyone, of course, for sharing their stories. This has been so nice to hear and so moving and so inspirational, honestly, every time I hear. And I've known you guys and I've heard your awardee stories, and every time it's so nice to hear. So thank you also, Jada, for bringing this up, is partnerships that you can be a part of as you do this work. So policy change has the potential, to create population level impacts, and that kind of change doesn't really come easily. It takes a lot of consistency and coordination from different stakeholders that you can work with. So like Jada mentioned, these are people who you don't even expect, or families who have been impacted, and those who support them. So they're different IBCLCs and people in the field. So policy change is really bigger than just one organization. And that's why partnership and collaboration is so important. And so I'm one of the representatives on the USBC's Breastfeeding Public Health Partners, BPHP. And this is an initiative where we meet with national public health partners to discuss different topics and activities. And these partners include National WIC Association, the American Academy of Pediatrics, AAP, Association of State Public Health Nutritionists, ASPN, the Association for State Enteral Health Officials, which is ASTO. We have NACHO, we have NAPLC, and so many more. And these breastfeeding public health partners, we come together to improve our reach and to impact the existing resources and the currently funded investments in lactation support. So just like you were saying, these partnerships are so important, and they can really come from anywhere, but these are ways that you can expand your reach. Is you can get people to know about the activities that you're working on by tuning into their networks as well as your own. We also enhance, collective capacity to be able to identify and address inequities and integrate breastfeeding into those broader public health agendas. And so each of these organizations comes with their unique experience, their skills, networks, and resources. And by prioritizing an ongoing partnership, we are really able to leverage each organization's strengths at the precise moment that we need it. So policy change is really a marathon. It's not a sprint. It's something that takes time and effort and consistency. And the impact is big, but it usually takes a while to achieve policy change. And there are a lot of decision makers that are involved along the way. So the most compelling messenger and the most compelling message will vary at each step depending on who you're talking to. And these partnerships allow you to bring the strongest possible message from the best possible stakeholder for any given scenario. We're able to promote our initiatives and multiply our reach, like I mentioned, by having our partners share within their networks. And we can learn more about our partners and their activities from the BPHP toolkit. So everyone can see what our partners are working on the BPHP toolkit, which is on the USBC website. And I can share that link in the chat. Something else that I'd like to lift up is that the organizations that I named are all national level organizations, but most of them have state or local level counterparts. So if you're working with a state or a county level bill, and you're considering which organizations you should partner with, but aren't really familiar with the particular organizations or aren't sure where to start, it could be really helpful to think about the national level players and then look to see if they have a state or local chapter that you can reach out to. There's also a lot of other ways to find and connect with potential advocacy partners, like, for example, our coalition listserv. And Jacqueline, we would love to lift up locks. And if you want to share that information once it's ready on our coalition listserv, that's a great way to stay connected and promote different advocacy work, but also promote work that your coalition is working on. Another thing is that any coalition or organization who shares your mission and ideals, and even those who don't, just like Jada mentions, can be a potential great partner. So I would love to hear from all of you who you partner with. Feel free to unmute or put in the chat box, maybe some unlikely partners like Jada mentioned, or some partners that you have been working with for a long time or for any amount of time. So some people in the chat are lifting up your fireman idea. I think that one was really creative, Jada. That's such an awesome idea. Okay, so Linda mentioned in the chat that Minnesota is working with Isaiah, I'm thinking, which mostly works with faith communities and faith leaders. That's another really potential partners for you all.
Yeah, that's a good one. This is Treva again. Let me see. I'm sorry, just trying to make sure you can hear me.
Yep, we hear you.
I was just thinking, it's probably not as creative as the fireman thing, but we have started working with community health workers and other home visitors and really training them to be what we call either a lifeguard or a cheerleader. And so that's one of the kind of the ways that we've been working kind of outside of the box. If they can't, I mean, they can help at least point you in the right direction or cheer you on. So that's one of our initiatives.
Yeah, thank you, Trevor. That's really helpful to know. You know, you can try, and if somebody isn't a partner, maybe they can be a cheerleader, like you mentioned, and point you in the right direction.
Well, very interesting to see Miriam in the chat section in New Jersey, partnering with the Advocates for Children of New Jersey, an organization that does the state kids count of markers for child health and welfare, and the New Jersey Education Association.
Nice, absolutely.
It reminds me of in Illinois, Miriam, you being in Illinois, that the Illinois Teachers Union, they were the ones that really spearheaded the passage of the law protecting Illinois teachers for their time and space for milk expression at work.
Wow, absolutely. The CTU, as we call it in Chicago, is a huge organization. So partnering with them would be Super helpful. And Cheryl mentioned others, broadband access organizations, airline unions, faith-based organizations. Yeah, and they're unexpected. Like Jada said, you can get really creative when thinking about partnerships. I think we can go ahead and next slide. Is that okay?
Hello again. Advocacy on tribal lands, guiding principles. Congress has the ultimate right to pass legislation governing Native Americans, even if that legislation conflicts with our Indian treaties. The United States owes a duty of protection to Indian nations and tribal members akin to common law trust. Indian nations retain inherent sovereign powers subject to divestiture only by agreement or by Congress. State law does not apply in Indian country absent authorization by Congress. Congress must clearly state an intention to divest in tribal sovereignty. Information from the National Congress of American Indians, expert from their 2019 policy update publication. Tribal nations provide a range of governmental services that include education, law enforcement, judicial systems, healthcare, environmental protection, natural resource management, and basic infrastructure such as housing, roads, bridges, sewers, public buildings, telecommunications, broadbands, and electrical services, and solid waste treatment and disposal. Census data plays a key role in allocation of more than $800 billion in federal funding for all of these services. We are on a learning curve when it comes to tribal community advocacy. We have a few resources to share, but I know there will be tons more, especially with continued work with missing, murdered Indigenous women, water access to tribal lands. As if you may not know, there's several tribal lands that do not even have running water to their homes, such as the Navajo Nation, oil pipes and sacred water, and moving forward with the All Children Matter. I don't know if you have been aware what that has been going up in Canada with our First Nations, and then also in the United States with the Indian boarding schools and finding children that have been lost and bringing them back home. Linda, are you able to share those resources in the chat box for me?
Yeah, sure, I'll do that. I'll copy and paste. These are a few resources from a webinar that was put on by the Mitchell Hamlin School of Law, which is in St. Paul, where I am. And they have a public health law center. And one of their policy advocates is Ojibwe, and she presented a wonderful session on just getting some lactation guidelines set up in the Fond du Lac Reservation, which is northern Minnesota. Oh, you got it. There you go, Stephanie.
Yeah, I found it.
Thank you, Stefana. So this is the webinar, and the PDF slides. If you look at the PDF of the slides, you can access all of the links. And there's a resource page on one of the slides that has quite a few really good resources for advocacy, particularly in tribal communities. So I'm just, I guess we're just wondering, has anybody on the call experienced advocating, particularly in a tribal community, and what that might have looked like? Or if you have any questions about that?
I know I'm still pretty new on that aspect as well, trying to advocate on both sides. Mm-hmm. It's almost like, you know, we're our own separate entity. We're our own little nation or world. And so just trying to figure out how to navigate both through those has been something that I've been learning as well. So this is all new to me still.
You were telling us about the fireworks regulations. You know, just how on tribal land, it's not subject to state law.
Yes, where here in Kansas, well, particularly like the state capital, Topeka, they're only allowed to just charge fireworks on on the day of and the day after, and it's literally like only a 3-hour window. Whereas on our tribal land that I'm working and reside on, we don't have that law. So we actually can just charge anytime, and there's no time frame. So, I think that might be just different with every tribal community as well, especially keeping in mind and being particular with areas that are prone to fires.
So I think that if you are working, and Anna mentioned that she went to a powwow this past weekend and used some of the Native Breastfeeding Week materials. Awesome. I think that's what does it mean for a tribal community to be a sovereign community? I think that's a piece of the navigation when advocating for guidelines or policy or changes in tribal communities. Is what does that mean that that community is as a sovereign nation? Oh, and sharing sharing information from the Native Breastfeeding Week materials. They should be on the Facebook page, right? Stefania?
Yes, they are.
Mhm.
And I'm so glad that powwows are starting back up again, Anna. We're only having a 1-day powwow for the Prairie Band Potawatomi. So I'm ready to get back started. So, because I offer a lactation station at the powwows.
Awesome.
It very is.
Very good. So does anybody have the link to the Native Breastfeeding Week Facebook page that they can put in the chat section? That's where a lot of those really good materials are. I might be able to, let me see if I can get it. Here we go. And it's the second week in August is the Native Breastfeeding Week. And this year, I know for sure it's going to be launched from Minnesota because Cami and Kim Salas-Moore are doing an IBC training the first week of August in Minnesota. We're in Minneapolis. We're super excited about that. And then they're going to stay an extra day to launch Native Breastfeeding Week. Jada, did you want to comment on what you said in the chat?
Oh, yes, I will. I was just saying that I work in a children's hospital, and so we have lots of everyone. We see some of the most fragile babies in the Southeast, and I find myself being extra vocal about needing to support Indigenous families when they come through. We don't have a lot of them, but when they come through, I am I'm like definitely making sure that they are not going unseen or under represented. And I know for sure that that has everything to do with like the exposure that I've gotten from USBC. And I met Cami at my very first breastfeeding conference. I don't know, six or so years ago, and so ever since then, I've just been like all ears and eyes, listening and learning. And so I am grateful, and hopefully these families here are grateful about the support that I am able to offer and that I encourage others to offer because of what I've learned here. So thank you all.
Thank you so much for doing that, Jada. I mean, that really does mean a lot. I know I try to work outside of my cusp and reach out, and I try to find those connections for people in different states as well.
Mhm.
Because sometimes I get, because there is not very many, and I will get from out of state, oh, you help with breastfeeding because there's not very many. It's like, and I was like, how can you help me? And I'll try to help them as much as I can. I'm like, I'm going to find you a resource that's in your state so that you have that access. And that is important. So, I mean, even though we are in our own little regions, we can always support worldwide and just find those what they need. It's important.
Okay, so with the wealth of information you just received, we are going to go into our breakout session, and we're going to discuss your challenges and successes with finding your voice. How does all of this information make you think differently about advocacy for your coalition? Do you have a plan, or do you have any questions? So we'll break out for about 10 to 12 minutes, and we'll come back and discuss what you guys have said.
Cool. And Miriam, do you want me to go ahead and break everyone out?
Oh, that'd be great. I was just.
I got it.
Thank you.
All righty. So, okay, the rooms are opening. And yeah, go ahead and join when they pop up. See you.
So I just wondered if different folks wanted to either put in the chat or if they wanted to unmute themselves, just reflecting on their conversations. I know our group had a really, really interesting conversation with a couple themes, but if anybody wanted to share what they discussed, feel free to do that now. I can probably start with our group. We had Stefana and Jacqueline and Anne with in our group, and two themes. One was if you're introverted, this is not like the normal way of doing things. Becoming an advocate and finding your voice can be really challenging for people who are naturally introverted. And then the second theme was culturally, for some communities, that humility and respect is a really deep cultural norm, and that may not seem like it lends itself well to very vocal advocacy. So finding partners that can help you find your voice can be important. Stefana, did you have any other?
No, I was just going to say exactly what you just said. So
This is Cheryl. I will say one of the really interesting things about advocacy in my years at the USBC is how much time I actually spend not talking to anyone, but doing like schedulers and emails. So I'm a big believer that there is like introverts, you totally have a role in this. It's a lot of it is, you know, for within USBC, it's not that we're the speaker, it's that we're like doing the like sort of the administrative part of like scheduling the meeting and then finding those folks who can then speak to an issue. So I wonder if that's a helpful way to think about it. It's like sometimes for me, the administrative stuff makes me a little bit crazy, but there's probably a lot of people who really love it.
I think in our group, one point Jessica brought up was just knowing where to get all of this information, because it's such a wealth of information. And if you're not involved with the USBC, what are other outlets outside of, big organizations like this to help form, the coalitions and give the information and the guidance that we've given in this technical session as well. So, I mean, I didn't even really know about this technical session until I was invited to participate in it. And I'm so glad, that I was invited to do it, because I've learned a lot. But, she did bring up a good point that if you're not a part of big organizations, you really won't get to learn, like Cheryl said, the small things, that the unwritten, rules or of lactation.
Absolutely agree with that.
Well, sounds like a perfect segue to our next section, frankly, because we're going to talk about understanding the process, the big process at the big P level, and then the process at your community level. So this is Linda. I'm going to speak just quickly to the process at the federal level and actually most states. So we have the House of Representatives and the Senate, and that's how it looks. And they're the ones that make the laws at the federal level. And in most states, it is also this House of Representatives and Senate. So it's this bicameral system. And this is it looks complicated and very busy, but if you, and you'll get the PDFs of these slides so you can look at this in more detail. But this is really the process that laws are made at the federal level and most state levels. So and I'm going to use an example that we have in Minnesota of our paid family leave bill, which has been trying to get through since 2013. So it's been a while, but it's been trying to make its way through the system. But every year it gets closer and closer to actually becoming a reality. So you'll see the green on the left, the bright green, that is where the bill is introduced. And that's where you have your community partnerships. You have a relationship with a representative or a senator who can sponsor the bill, but that's where the writing happens. And that's where a lot of the advocacy happens. And you'll see in this image that there are several places, both where you'll see the little person in black with like the little briefcase. That's where a lobbyist or testimony can happen. That's where you in the community can share your story, share some information that you have a role in educating or influencing policymakers. You'll also see there are many places where there's like a little red starburst in a black where it can go bust. That's where it can stop and not proceed. So there's many places. And when I think of this as a story of both perseverance and partnerships. So this is a long process. Cheryl, I think you've commented on how some people think it just happens. These bills just happen, and they don't just happen. There's a very long process, and it's persistence and partnerships. So the bright green is really that community part where you have the most influence in crafting the bill and developing it. And then it gets introduced. It starts in the committee. The yellow, there is the committee work at the House of Representatives. That's usually where it starts. It can start on the Senate side. So go through the committees and through the Senate. I know there are at least one or more states where it has to start on the House of Representatives side. It doesn't start on the Senate side. In Minnesota, we have legislation is passed every other year. So knowing what your state's little peculiarities are is important, but this in general is how it works. So it goes to the committees. The committees have hearings. People can testify, share their stories. This is where you might be called up to share your story as a member of the Breastfeeding Coalition. And then it goes to the general House of Representatives. And each level it can pass, and then to the Senate in committee, then it gets put on the agenda and voted at the Senate level in the general Senate. But the one that was passed in the House of Representatives and the one that was passed in the Senate have to align. So there might be some back and forth. And then it gets into the bright blue where it can be voted in and stamped for approval by the governor or the president or vetoed. So that's a really, really simple version. But in Minnesota, the paid family leave bill has been trying to get through this process since 2013. So every year, so it's 2013, 2015, 2017, so it's in odd years. Every year, it's been reintroduced. You can't just stop 1 year and then start at that same point the next legislative session. It has to start at the beginning again. So every year it's been reintroduced, and the green, it's looked a little different each year. There's been more partners each year. In the chat section, I'm going to put a couple links. There's 2 links. One is a PDF of sort of a fact sheet on the paid family leave. You can see how they presented it. And then there's a link to the website of the coalition, the state coalition. So that's a long list of state partners that are trying to get this bill through. And that list started small in 2013, and now it's this long in 2021. So every year it's a new bill, looks a little bit different, has new partners, and gets a little bit further. One interesting thing when I was interviewing folks who have worked on this bill, trying to get it passed, is that in years when the House and the Senate and the governor have been all the same party, they haven't necessarily created a very a bill that they've actually had a bill that's sort of simple, because there's a sense that if everybody's at the same party, you don't want to rock the boat. You don't want to anger certain people. You want to get things through simply. So you would think that if everybody's at the same party, you can get more ambitious bills through, but that wasn't necessarily the thought of the big state coalition. So in years where everybody was of the same party, they actually had a less ambitious bill. But then in years when there's a Senate and a House that are of different parties, that they actually had more ambitious bills, which to me seemed counterintuitive, but it made sense for the coalition working this through the system. So in 2017 was the first time it actually passed from the House into the Senate. Didn't make it past committee. 2019, it passed the House and all the committees in the Senate, but never got on the Senate agenda. And in 2021, same thing. It passed the House, all the committees in the House. This year, I was one of the folks who testified about paid family leave specific to breastfeeding. It made it into the committees at the Senate, passed all the committees in the Senate, and didn't get on the agenda for the Senate. And just another interesting aspect of this is that since paid family leave is becoming better and better known, and more of the public are behind it, and that coalition has more and more partners, actually it's becoming more of a bargaining tool. So when it gets to the Senate and there's some bargaining, like we'll give you this piece of legislation if you will give up this piece of legislation. There's bargaining, that actually the paid family leave has so much political or community support behind it that it actually becomes a bargaining tool. So that's what I know about the federal and state level process. And I'm wondering if there's any questions or comments or examples. Cheryl, I'm wondering if you have any comments. I know you've worked on federal legislation too, like the Pump Act. Any other insight into how that process works?
You covered it really well. I'm sorry, I tried to move outside and it's kind of loud. I
think you covered it really well, and it really, like, I think speaks to what we talked about at the top of the call around, like, this is a really long process, and there are going to be lots and lots and lots of action points along the way. So kind of keeping like that big vision in mind is really key, and just like really thinking about, as you're sort of moving along this process, or like really preserving relationships, because it's going to, you know, pop up again later in this negotiation process. And then the other thing that came up for me when you were speaking, Linda, was the part around, oh, and the legislative session ends and your bill hasn't gotten through. Oh, so painful. And then you have to start fresh the next congressional session. But so it's really upsetting and sad when that happens, but it's also you're building on, you know, each prior year. So it's really easy to get someone who co-sponsored your bill last session to probably do it again this year. So it's starting over, but it's really just like the whole process is about each step that's taken, every story that's shared, each congressional visit, you know, it's all just like one more block to build up into an actual public policy.
It feels like every year is an opportunity to apply some of your lessons learned. Do we make this bill a little bit more ambitious this year? Do we make it a little less ambitious? Do we have new partners? Do we have a different take on things? Do we have a different approach? Do we approach the testimony phase a little bit differently? I think that every year is an opportunity to apply some lessons learned.
Totally agree.
Let's go to the next slide.
Okay, so learning about the local partners and local processes. I think one of the, Jada said earlier, go to people who think they're not even related to breastfeeding, your firemen and all those different people, but also learning about the policy development within the local government, using the town halls, learning about the city council process, the mayor councils. I wrote down a lot of things, even when she was talking about the health councils, the champions, the partners that are affecting the local policy development, statewide or national policy change. Started thinking about the community, who's engaged in the community, the elected officials, good opportunity to start talking about breastfeeding, to find out where they are. I wrote down a whole list of people that I am going to talk to see, just to bring it to their attention, to make aware, engaging with community leaders, just bringing it up and finding out where the local policies are, their processes on how they do things. I'm thinking about the different network meetings, going to the board meetings and things like that, using that opportunity to find out how to introduce change, basically, but learning about the policies that's already in place, and how and who's those champions and those people that we can actually partner with to engage in those conversations. And feel free in the chat to even put in more people or more processes or things that we can actually look at and go through. You know, for some of you all, you've been doing this like Cheryl for a long time, and you know how we can actually make this work sustainable. You know, understand that slide that Linda showed, but I was even thinking on a local, on a smaller scale. Where does that, when it's introduced in those engagement conversations, and then where does it fall off? You know, so it may not be that big that big picture, but even on a small scale. And I'm looking at learning about how they do things on the local level will actually help it to move, so that it can start gaining attention everywhere, and bringing it up and finding out where what their policies are for doing things.
This is Cheryl again, and actually a really good example of exactly what you're describing, Jackie, just happened with the Pump for Nursing Mothers Act. Like we had been working this bill on the Hill and everything, and it became really clear that we needed to have a stronger presence from the education industry to show so the Pump for Nursing Mothers Act would expand coverage of the break time for nursing mothers law, and one of the excluded categories of workers is teachers. And so when it became clear that we needed to have a stronger showing of support from the education sector, but we had no contacts, like that's not a partner that we had typically been working with. I didn't personally know anyone or anyone on our team. And so we really had to sort of think about exactly what you're describing of like, okay, but who do we know? Like, who do we know? So it was going to our own individual teachers unions, like at the school my kids go to, and then talking to my friend from back home who gave us an email for their like regional union rep, and just asking the question and raising the attention on it. And because eventually what happens is that they're like, we hadn't thought about that. And so then they ask around, and you're continuing to ask around, and those questions all sort of evolve into this new industry taking it on. And we were able to eventually get the National Education Association to sign on to our letter and endorse the Pump for Nursing Mothers Act. And it really started with, these questions to our local unions, teachers unions, so that I think that's a nice example of like just asking around, who do you interact with in your day, and just ask them, because they're going to know. They live and breathe there. They know who the right person is.
Stories have been passed down from generation to generation as a way to enhance learning and knowledge for thousands of years. A good story engages our curiosity, emotions, and imagination. We've talked quite a bit about the transformative power of storytelling and its potential to bring about change. In healthcare and advocacy work, stories are provided as a useful tool in engaging people with quality improvement work. Telling the story of one patient's or family's experience of care can memorably illustrate improvements or problems in the pathway of care. Statistics and data have an important place in monitoring and understanding services and facilitating improvement, but the right story can have power to motivate and change minds. Storytelling approaches help us inform debate and discussion, raise awareness of the work of our grant holders and people we work with, as well as bring key issues to life. They can help us appeal to hearts as well as minds. The aspect of storytelling or presenting a different perspective of the world is important when it comes to connecting with each other. It gives us an opportunity to learn from one another in our experiences, and it can shape and strengthen or challenge our opinions and values. When a story catches our attention and engages us, we are more likely to absorb the message and meaning in it than if the message were presented with simple facts and figures. So when we think about sharing stories, we've done a lot of it here this afternoon. And I think we're all a bit better for it. But we can set up local story banks. We can set up um, um, voice and photo um, uh, collections. Uh, One very powerful, USBC had COVID stories last year. About this time last year, I think COVID stories was launched, which were just like tear jerking and gut wrenching. Um, and a lot of those tear jerkers were stories of success, but they can be very powerful. But one that another outside of breastfeeding that comes to mind is the Humans of New York platform blog. I don't even know what it's called, what it would be considered, but Humans of New York, where there's um, a storytelling episode. I see them on Facebook. I think there's now an actual book, and they may be on Instagram. But it's just a collection of daily stories of people who live in New York, how they arrive to wherever they are in life, what their history has been like, where they hope to go, what might have happened to a big dream that they had, um, and they are very powerful. And it is, it has just been a great way to get everyone thinking about any topic in a different way, because they are just everyday people sharing their stories. And we have all of those stories, no matter where we are in this organization, in our local organizations. We have a story. As a parent, as a professional, as a supporter, as an advocate, wherever we are, there is a story. We have them to tell. So when we're talking about like being an introvert or being an extrovert, if for and I'm a little bit of both. So for those of us who are introverts, sit down, write a story, send it out. Right, those are the people who are great at, like Cheryl talked about, like being in charge of making sure that everything is signed on, writing writing a blurb about a personal experience or a letter to a public official. But getting these stories is really important stories. People can relate to other people much more completely than they can relate to a group. And so these stories are very, very important in this work.
Awesome.
Okay, so we will be wrapping up this technical session. We would like to thank you for participating in this series all about advocacy. And we hope that you understood the different types of advocacy, such as legislative policy, educating policymakers, and administrative advocacy. And hopefully your coalitions can engage and know the difference between big P and little p policies, and how to utilize and relate the power of storytelling in order to shift policies to local partners and local processes. We also hope that you not only enjoyed the session, but you're able to take away tips to build your coalition and identify goals and implementing your plans for the next step for your coalition to support breastfeeding families.
All right, thank you so much, Jada. Thank you everyone for such a wonderful session. And we are going to be wrapping up with just a couple of updates. So for starters, we will be sharing a survey link here in the chat box or in a follow-up email. It should take no more than 5 minutes to complete, and it'll help us design future sessions. And thank you so much to everyone for joining us. As we mentioned, this is a 7-part series, and this was our last session. So if anybody wants to see the recordings on these, they have been recorded and they are available on the USBC website. And we are hoping to do more of these in the future. So these surveys that I mentioned are very helpful to hear what other topics are of interest to you all. And we do know that every coalition is unique, and as such, we are providing technical assistance one-on-one sessions, and there is a brief online form that you can give us some contact information, just the name of your coalition, a brief summary of what you would like assistance with, and we'll be sure to follow up so we can share those as well. Also, just a quick reminder about the 2021 MBCC. If you did attend, please remember that you have access to those recordings for 6 months. And if you did not attend, we are still registering people with a 10% discount to have access to those recordings, except for the live networking sessions, of course. And with that, thank you all so much for what you do. Thank you for joining us, and we hope to see you all very soon.
Thanks, everybody.
Thank you. Bye.
Thank you.